There we go. Okay. And I will send this to you. I will send it to you.
Yes, Mr. Atikur Rahman and Jahanara, ma'am, please response. Here very noisy places. You can noise. Here very noisy places. Your response, ma'am. Please you record.
Hello.
Yes, it's recording.
Hello, Mary.
Yes.
Hi, it's recording. I have it recording.
Yes, Mary, thank you for your mail. I have got it today and I responded. It's me, Jahan. Am I audible? Clearly audible to you?
Yes, we can hear you.
Okay.
Yes.
It's me, Jahan, that actually I have sent you a mail yesterday and you sent a mail to me today. So here are some students actually joined with me.
Yes, hi.
There is Alif Hassan, Rehan. Rehan, am I audible to you, dear Rehan? Rehan, please respond. Just unmute yourself. And there is Sami, another student. I have some wonderful girls also here to join. Hello. Rehan, say hi to all.
Hi.
Hi, Rihan.
Hello. How
Sami, am I audible to you, Sami? Please say hello to all. Sami. Sami, just unmute. Yes. He's the little student of class 7. Yeah, he's the first boy in my school. And Rehan is a student of class 8. Here is my another student, Alif Hassan. And I'm waiting to join some other students. They are also wonderful and very much interested to contact with you.
Excellent, excellent. So we have, and we also have another teacher from Bangladesh here as well. I know Mr. Nazmul is on, and I know he has some students. So we are the United Nation Club, and today we're going to be connecting on sustainable goal number 3, which is good health. So we're just going to talk about like post-COVID, even during COVID, perhaps, and just some concerns in the healthcare system. I know your system and the system here in the United States is can have some similarities, but can also have some differences. So we would just love to know a little bit about that. My students have a very short presentation, and then we have to end at 8:45 my time, which is about 30 minutes, because I have an important meeting that I have to go to. Our school day hasn't started yet. All right, so are you ready to present?
Yes.
Okay, so let me share the screen.
Access to it.
Okay, so share. All right, and then. Hold on. Okay, so where is it in the
It should, maybe you might have it in Google slide, so maybe go slide. Yeah,
here?
just hit slide. Okay. So just search it, maybe like search SDG.
Nope, this one?
Yes.
Okay. All right, so can you see it?
Yes.
Yes. Yes. Okay.
Yes, it's clear.
Perfect. I'm going to put this down here, okay? Go ahead, you can stand up.
Okay.
Do it.
SDG Goal 3 by the IMS UN Club.
Oh, you can move that over. Yeah.
But first, a presentation about our school. About Jupiter, Florida. If you look at a map, you can see that Florida is in the most southeastern part of the US. We are here in the red area. And then And then next to the star is where we have our country, where we have our state. We go to school at Independence Middle School. We have many sports such as soccer, volleyball, basketball, track and field, and more. We also have academies, special electives such as PsyQuest, pre-med, pre-teacher, pre-law, and pre-business. Also, we have regular electives such as computer class, art class, Spanish, and gym. There are also many clubs here such as robotics, book club, and this school club, UN Club. Right. What is Sustainable Development Goal number 3? SDG Goal 3 is about ensuring healthy lives and promote well-being for all ages. What's going on?
Here. It's just the, go ahead. All right.
It's like somebody,
Oh,
it's not ours, it's somebody on the thing, I think.
okay.
But the point is, like, these are all the things that this whole thing basically lists. For SDG Goal 3.
Okay.
Okay.
Is it shared with anyone else? No?
I don't know. Like, here, I think. Yeah.
No, they don't have access to this.
I don't know.
Okay.
In Florida, our area is a large tourism spot for its sun and warm weather. Because of this, we can't really shut down during a health crisis or industry will lower and we'd have a problem with poverty. This issue was very hard during COVID. In our country, we often need to maintain good health so we can do the things we need like other countries.
Yeah. Okay. All right.
As of late, we have gotten a bit more cautious in this area.
Oops, what did I just do? All right, go ahead.
Okay. Hello. That's not moving.
The keyboard has been broken at times. Is that it? Did it move?
Yeah, I think so.
Okay.
SDG Goal 3 is about health and well-being. However, this was harder for us during COVID since we had to be very careful about our health. COVID-19 affected how we cared for our health, since now we have improved how we monitor and care for our health and the health of others. Increasing support to mental health. How can we ensure SDG in our communities? Increasing support to mental health. During the last century, major effects have been deployed to promote physical health, cooperation, caring economics, promoting altruism, and new economic harmony. We can achieve Goal 3 through tobacco control, medicines and vaccines, health financing and workforce, emergency preparedness, and something else that's blocked out. Thank you for listening to our presentation. We all hope you enjoyed it.
Okay, so let's, okay. So, all right. How do I?
Unshare?
Stop sharing. Okay. All right. So we would like to know a little bit about how your country dealt with COVID.
So I think it's our time to say something about the COVID-19 situation, ma'am.
Yes.
Okay. So I would like to request my students, Alif Hassan, am I audible to you? Can you explain, yes, please, what is the condition that was actually in our country when we are suffering this COVID-19 situation? You will describe, just 1 minute, please, dear. You will describe the similarities between Bangladesh and then Florida and dissimilarities. Okay. Over to you, Alif Hassan. Thank you.
Well,
in our case, Bangladesh being, a developing country, it is mostly dependent on, smaller works like agriculture and also exporting garments. And also in some cases, like medicines, like pharmacy. But you must have, like, if you go to even the US or European countries, you'll find a tag called Made in Bangladesh in every, let's say, garments or every kind of garments. Like after China, Bangladesh is the second exporter of garments in the world. So we're not dependent on, any kind of what do you say? Like foreign investment or foreigners coming, like visiting our country. It's not like here. In our case, it is a small country. I think it's smaller than Florida as far as I know, but our population is actually half of the US. So you can see we are one of the most densest country in the world, period. So in our case, the government actually had some steps to have taken so that our case isn't as worse as the other, developing countries. In fact, in some cases, Bangladesh has been recognized for the steps it has taken in the COVID period, which had led to like severely less damage if we compare it to other countries. First of all, in this case, we had early response. Like Bangladesh was relatively quick in implementing measures to control the spread of the virus, including closing borders, suspending flights, and implementing quarantine measures for those entering the country. After that, we had testing and tracing, where Bangladesh had worked to increase its testing capacity and has also implemented contact tracing program to try to identify and isolate those who many have been exposed to the virus. In fact, as far as I remember, that there was an app built by the Bangladesh University, like BUET, which is the Bangladesh University of Technology. The students actually made an app so that they can track the COVID victims and they can isolate them in their house, and they can even send medicines and care so that the virus doesn't spread. After that, we have public health campaigns. The government actually publicized, or the government spread the knowledge about the COVID through social media, through classes, like online classes. We had online classes here too. We use Zoom, and you guys, I think, use Google Classroom, if I remember, and whatnot. Of course, we had treatment and care. And in fact, I remember that everyone was given vaccine when I was in college. Like in our case, college is basically not university; it's more like high school. So everyone it was mandatory for everyone to get vaccinated, also booster dose and etc. if they wanted to give the exam. So that was one thing. Of course, we had economic support from the richer country, like even UN actually helped us in getting the vaccines. Of course, our neighbors like India or UK, they also helped. And yeah, that's where all this effort, the pandemic has still had a significant impact on Bangladesh, with many people experiencing economic hardship. Like many people actually lost their jobs, but overall, we did a better job than the other countries around us. That's the point. Yeah.
Yeah, that's really, thank you for explaining that. Are COVID requirements and restrictions still?
No, they have been, left out because the COVID has been the pandemic. We have recovered through it very truly, actually. So there are no COVID patients anymore. There have been cases of malaria increasing, but other than that, no, everything is running as previous. And yeah, overall, I think it is much better condition. The COVID period has officially ended for Bangladesh.
Yes, yeah, same here, right? Yeah. Does someone want to talk about what we had to do with school during COVID? Oh, go ahead.
Yeah. So during COVID, we mainly had to stay indoors for most of the time. If we went to like the grocery store or something, we had to wear a mask, and we had to learn online, which was very difficult, especially since for me, I got all my work done too fast for the first year. So I basically had nothing to do since we were all stuck inside.
Yeah, it was hard. It was hard.
And then later we had to stay on And we basically had to stay on a video call during the whole entire day, the year afterwards, which was very difficult for us.
So if I may ask, what was the duration for your quarantine time? Like how many years, 1 or 2?
About a year, I'd say.
In our case, it was like 2 years.
2 months.
So
Yeah,
2 years, everything was.
Yeah.
We were one of the first states to really not shut down. All the 50 states here in the United States, Florida was one that
tourism industry. So
yeah, we were one that kind of was determined to stay open because the economy depends on tourism.
So how many people were like an assumption? How many people were hospitalized or something like that? Like
yeah, that's a great question that I wish we had more accuracy on. Our hospitals were definitely full. Really full.
Yeah, my dad had COVID.
Yeah. So, and I know a lot of the kids' family members had COVID, and a lot of kids had it itself. So, but the actual numbers, I don't really know, to be honest with you. I don't think that information was ever even shared with us.
I don't think they even want to.
Yeah.
I see.
But everything has dropped. Everything's back to how it used to be.
Pretty much, yeah.
Yeah.
Oh, that's good. Oh, that's good.
Yes. So can you tell us a little bit about your healthcare? Is it something that that is free? Do you have to get insurance?
Ma'am, I think
particularly do not know about the insurance or not, but it's not quite free. We have governmental.
Alif, I want to a little bit interrupt you. Sorry, dear. Ma'am, actually, in our country, it is not very much popular that students has got insurance facilities. Like in your country, it's very much available. So yeah, here it is totally absent that we don't get any students insurance or facilities because you know that as my students mentioned that it is a small country in this South Asian and our economical condition is not so well. But I want to tell you that my government has made an extraordinary role on the pandemic situation. Everything was under control, and the percentage of the COVID-19 patients and dying people was much more less than other our neighboring countries. So in this way, our government actually handled this, but we don't have any kinds of economical or insurance like the other countries' students actually got this help. Thank you, ma'am.
Oh, no.
Thank you, Maria.
Yeah, thank you. Thank you.
Well, Bangladesh is not actually completely industrialized or completely urbanized. So in many rural areas, there is no healthcare system that much. So, and in the case of rural areas, actually the virus didn't spread much in the rural areas. Mostly it spread in the cities where the airlines are here. And so because the virus actually came outside. So in the cities where the airports and the other transportations are there actually the main victims were. So the government actually shut down all the cities, which is why it wasn't as threatening as it could have been. And yeah, that is the case. And as far as healthcare goes, I don't think the students have any healthcare, but we do have governmental hospitals where you can get free treatment if you're not economically stable enough. So that's that. And yeah, overall, in Bangladesh, healthcare is pretty mediocre, especially not that good compared to US, of course. Yeah.
So if someone goes to the hospital, oh, you found some numbers?
Yeah.
You researched some
like
numbers?
confirmed cases over 7 million, like
Oh.
700,000 confirmed cases. I don't know if it's like for just our region for the Florida. I don't really know. That's about 86,000. But it definitely helps because right now there's about 70% of Florida vaccinated, so I'm sure it helps.
Yes. Yeah. We still have a large portion of people in the United States that are vaccinated, and we still have about, I would say about 20–30% that are not.
It also has a chart that says the amount of
Yeah,
cases.
you can show them.
Yeah. The orange thing, the orange
Oh, I see.
it says.
Thank you. Spiked in the.
So if someone was to go to a hospital in Bangladesh, do they have a bill that they have to pay at the end, or is it covered by the government?
Well, it depends. It's not 100% covered by the government. If it is a governmental hospital, some portions or some cases, it will be covered for some special diseases. But if it's like cancer or something like drastic, then it won't be. And if it's a private medical, then of course not. Will have to pay full price. So yeah, our healthcare system is kind of mixed in a sense.
So I don't know if the students know this. I don't know if you're aware, but healthcare is the #2 cause of debt where people are struggling to pay.
Sounds reasonable.
In the United States. So it is the #2 reason of why people are financially hurting.
Makes sense. Healthcare is.
It's very expensive here.
They don't have like
Very
insurance.
expensive. Insurance is at sometimes a month can be close to $1,000 or more.
My sister, like she got 9 from like Medicaid, and my dad was like, "How can you possibly get 9 from that?"
Yes.
Stuff?
Then we have a lot. Then our government has Medicaid and Medicare, but it's very hard to get qualified for it. And then you're really limited anyway if you do get qualified for it. So, and then you also need dental care and you need eye care, and all those have to be covered with a cost. So it's very, very, very expensive. And if you go to a hospital, I mean, you're looking at thousands of dollars just for walking in to a hospital. So we have a lot of people that don't get the medical attention that they really need because they just can't afford it.
I see.
Yes. So this is one of the things that our government is always talking about, finding solutions and trying to close the gap on the issue of healthcare, because more and more people that are living here are not even insured with healthcare.
The richest country on earth.
So do you find people that are in poverty, do they struggle with, do they have to worry about healthcare?
Bangladesh actually faces child mortality rate even now due to poverty. Like, I don't know the exact numbers, but there, yes, even in my locality, there's a huge number of people who are poor, and I'm in the Dhaka city, so you can understand. In fact, I think our average pay is like, I think it's 5 times lower than your average pay, or maybe 10 times, I don't remember. But so yeah, we have a huge class of, lower, economic people.
Yeah.
Here in Bangladesh, like poverty rate is pretty high.
Nazmul.
Yes. Any Bangladesh student who any question there, ma'am? Any Bangladesh student, please respond. The ma'am question, please. Bangladesh. Here many student
Nafisa,
and teacher Bangladesh to join your.
Nafisa,
Yes.
do you want to like to ask any questions about this situation? Nafisa, am I audible to you? Do you want to hear something?
Actually, here noise, very noise. Speak. Good. Continue. There are many students, others. You can their chance to them and they speak.
Oh, there we go. Nazmul, what time is it there? Nazmul, what time is it in Bangladesh right now?
Here now 7:30.
7:40.
7:39.
7:40.
7:39 p.m.
Yes.
night.
It's almost 9 a.m. for us.
Yeah. Yes.
Ma'am, do you like if you think that your student want to know more, then they can ask questions of my students. Maybe some other students can reply this.
Yeah. Anyone have any? You can talk about school. You can talk about their day at school. I mean, it doesn't have to be about healthcare. But I know I learned a lot about the healthcare. That's one thing when I travel, I just love to always learn about. So does anyone have any questions? School?
There are some students like Bishti,
In Bangladesh,
Rehan,
student,
Nafisa.
please.
Do you like to ask something?
Yeah. Okay, ma'am, continue.
Nafisa, am I audible to you? Unmute yourself, Nafisa.
Can your students?
Abir from Bangladesh. I think I know you.
Now I know.
Hello.
I know. Yes.
Do you like to ask something here about our today's topic, SDG3, good health and well-being? So if you want to ask something, please say.
Okay, I was listening the whole meeting for a long time, and
okay.
I think I have nothing to ask.
Can you?
Maybe it's a technical issues. Okay. I want to hear from any girls. Here, Brishti, Nafisa, and do you want to like to say something here or ask anything, please? Just unmute yourself. Ma'am, actually, I think the students learn a lot through this discussion that one of my students answered your questions, and your students' nice presentation actually explain a lot of things. So I think there is no question here on behalf of my students.
Okay.
So if your students wants to know anything, then they can ask.
Yes, we have a question. We have a few questions.
Do you guys go home for lunch or do you stay?
Dear, please speak loudly. Here is a technical, actually, net issue. So please loudly speak. Yeah.
What time do you guys?
Please again, dear student, please again your question.
Do you guys go home for lunch or do you guys
like what time do you have lunch?
Yeah, can you tell us a little bit about
school day?
Your school day, but specifically like how long your lunch is, and do you go home for lunch or do you stay on the school grounds for lunch?
Well, it depends.
Okay, Alif, I want to give this chance to Nafisa. Nafisa, am I audible to you? Sure. Please say something. Actually, what did you do on that COVID-19 situation when you are in your home? Are you staying in your home to take all the continuous processing in your educational system or anything? Nafisa, am I audible to you? Nafisa?
Yes.
Nafisa, yeah. Okay, so please tell something about what actually did on that COVID-19 situation. Are you staying in your home or how can you contact with your teachers, each and everything? Please say something. Here is Nafisa, a student of class 8. Nafisa. Hello. Is there okay, Nafisa? Please speak.
Ma'am, I think Nafisa has a network issue. Can I continue?
Yes.
Yes. Okay, continue.
Of course.
Okay, can you repeat the question again for me?
Actually, what did you do on that COVID-19 situation? How can you conduct your classroom, or how can you contact with your teachers or activities? How did you pass that?
On COVID-19 pandemic, I used to contact with my teachers via a Zoom meeting most of the time. And sometimes I meet with my friends and teachers in audio call or video call in Emu or Messenger, etc.
Thank you, Abid.
Thank you.
And, how to continue your teacher? to join with you. Zoom, Team, Google Meet.
Now,
Yes, I use Zoom, sometimes Skype, or sometimes Google Meet.
Okay,
to
thank you.
Continue with my teacher.
Mary, is there any question?
Any other questions? No. You have a question? Yes.
Thank you so much, dear student.
Okay. Right. We do have another question. Come on, Gabby.
What's your name, dear?
Hello, how are you?
William? Are you William?
Can you get? You can talk right in there. All right.
What sports do you have?
What sports is your country known for?
Well, our country is known for cricket. You know,
Cricket.
although it's not our national sport is kabaddi. And cricket is actually, you know, is an Englishman's player. It was introduced as in the colonial period, like in the British colonial period. And after that, you know, India joined, and then Bangladesh joined, and Pakistan joined. So yeah, cricket is mostly famous, or well known for cricket. But our
do you know,
sport is
dear
kabaddi.
student, do you know Saqib Al Hasan?
No. Can you explain?
No, you don't hear his name. He's the world famous.
Do you guys watch cricket?
Cricketer.
I don't think you guys watch cricket much. I think you guys are more baseball. Baseball. Right? You guys are more baseball.
Okay.
It's okay.
Yes, no, but it's definitely something that I know your country is big on, and I wish it was brought here more, because I got a chance to play it and I fell in love with cricket. I just had so much fun playing it, and it's not an easy sport. So we don't really hear a lot about cricket here, but if you ever get a chance to YouTube it or watch it, I think you'll fall in love with it. It's a really amazing sport.
I would recommend the T20 series. Like the test series are just too long and too boring, especially for this generation. But the T20 is much more shorter and much more, you know, thrilling to watch.
Yeah. What now is India and Pakistan your biggest competition?
Well, yeah, India is one of our biggest competition, but I would say like England is also one of our biggest competition in these sports. So yeah, it's kind of like, you know, since they have ruled us in the British period, colonial period, so it's it's like a historical scene when Bangladesh versus England, or a subcontinent country versus England happens. It's like, yeah, we're giving our payback. It's kind of like that.
Yeah.
But other than that, yeah, it's just for fun.
And what about rugby? Is rugby big in Bangladesh?
Nope.
No?
Rugby is not played at all.
Yeah.
Atik sir,
Football
please
is
say something
famous.
about this game. Are you familiar?
Yeah, I know a little. Thank you, ma'am. I know a little about rugby. And in our country, it is rare game. But in the official sector, especially army sector, they will play rugby. But it is not familiar or popular in our country, like football and cricket.
Ah,
absolutely right.
In Bangladesh, our national game is kabaddi.
Yeah, ma'am.
Yeah,
our
my student mentioned it. Our national game is kabaddi. We know it better than rugby.
But we love football very much. It's true.
Yes,
and
definitely.
Dear Mary Richi ma'am, you know that in the World Cup Qatar, Bangladesh was the big supporter of Argentina. And you know that it spread out all over the world. And when our cricket team won the match against Pakistan, Argentina people also support us. And they know now that there is a country in the world named Bangladesh. But in past, they don't know. But present, if you tell any people or in Brazil, they will know the name of Bangladesh. And we love football very much. And our player at this present, Cricket is our also second popular game. And I think all people like it because in cricket game, our country already participate World Cricket Game. So we are very happy and we are lucky that our players are now playing cricket in the World Cup. Thank you so much.
Yeah, no, thank you. This has been a fantastic session. I truly appreciate the teachers and the students for connecting with us all the way from Bangladesh and for telling us about your healthcare system and about your country and your sports. And I look forward to connecting again. I know, Nazmul, I know this is our second time connecting. So, so thank you so much.
And ma'am, next time I want to say that our school student, sir, ma'am, our school student already win the national game, like hockey, basketball, our girls student. And every year, our school player won the national game every year. So we are very lucky. And in our national federation, already our students are still now playing hockey, basketball. And we are very lucky for that.
Do you play? Do you also have netball? Is netball pretty big there? Netball's like basketball.
I don't know what netball is.
It's I don't know. When I played cricket in Australia, a lot of the cricket players were talking about netball, which was like it's like basketball, but the hoop is really small, and the ball is really small. And so I was learning about it, and I didn't know if it was something that was very popular in your country.
Thank you. And if you have time next time, I want to display a few our Bangladeshi local game. If you want, we can do that session next time.
Yes,
no problem.
Absolutely.
I want to display. Yes, ma'am.
Yes, absolutely.
And I hope your student will be like our local game, I think.
Yes.
Thank you, ma'am.
Thank you. Have a wonderful night.
Not only that.
Thank you.
Not only that, you actually
our
cultural
very happy.
Thank you. Thank you so much.
Bye. Thank you.